Are you Michelle?
Yes.
Hi, I'm Rachel. I'm a student nurse, and I was going to come observe you with your patient today.
Okay.
Can you tell me a little bit about who we're taking care of?
Sure. We're taking care of Ronald Jarvis. He is a 67-year-old male. He is a full cold and he has no allergy. He's in a room 6-2.
Okay.
He was admitted today and he was complaining of increased blood glucose, about 300 in the last 5 days. And he also have a non-healing wound in his right heels. And he tried to treat at home, and so that's why he came. And then he had this non-healing wound for about 3 weeks. I'm gonna talk about him a little bit for you. He has been diabetic for the last 20 years. He's a type 2. His A1C is 6.5%. It's a slightly increase from the last 3 months ago. He is on regular insulin 4 times a day and Lentins a night. His vitals were fine, was 128/70. His pulse was 76. His respiration 16. His O2 was 96%. His last glucose was 242, and his pain was 1 in a scale of 0 to 10. He also had an IV in his right forearm, and he had an morphine, IV morphine PRN. In the skin, he has the wound, the stage 2, but the other texture is warm, pink, and dry. His respirations are clear in all lobes. He's non-smoker. His red blood cells is slightly low at 4.5%, but his H&H is normal. His GI and GU, he has the active bowel sounds in all quadrants. His abdomen is flat, symmetrical, soft. He denies any dysuria. His cardiac, his S1 and S2 is clear, regular, but his dad died of heart attack at age 53. He's alert and oriented ×4. He wears glasses. He's a little tingling in the lower extreme, in the extremities, but he's taking the gabapentin and the morphine PRN. He's a 5'5" strain. He's in a low risk for fall because of the wound and also because of the neuro pain. But he's steady gait and independent. He's constantly weight, and has no thyroid problem or anything. We have to monitor his vital sign, his blood glucose, make sure he has the meal and a bedtime, and we make sure the pain levels. We also put in the order for he has the wound dressing 2 times a day until he's being seen for the wound team. The doctor has ordered for if the blood glucose is more than 301, we need to call the doctor. And he also requests some information about the 1800 American Diabetic Association diet that I already provide to him. Is any question do you have?
Yes, I do have some questions. Why is this client receiving this medication?
To help with his blood glucose.
Okay. What action does the medication have on the body?
It will help facilitate the movement of the glucose into the cells. And it will stimulate the glucose uptake into the skeletal muscles and fat. So it will inhibit the hepatic glucose production.
Okay. When should you question administering this medication?
If you notice any extremely diet change in the patient, if he wasn't eating or if he's being completely strenuous exercise, if you notice any signs of hypoglycemia, if he's a little shaky, clammy, sweaty, pale, dizzy, confused, bottom line is you need to check the blood glucose.
Okay. Does this medication have a therapeutic serum level?
No. because this medication is stable and long acting, so it has no peak.
Okay. Which vital signs must be monitored?
All the vital signs, but most important will be the blood glucose.
Okay. Which physiological parameters should be monitored when the medication is being administered?
You will teach the patient to perform a blood glucose test before administer, and you will make sure that he's eating. You access for any signs and symptoms of hypo or hyperglycemia.
Okay.
And you want the patient demonstrate to you that he's aware of the symptoms.
So those are interventions that should be taught for safety, medication safety?
Yes, and also how to self-draw the insulin and self-administer the insulin.
Okay. What are the side effects and potential adverse reactions?
Always when you have the insulin, it will be the hypoglycemia. You also do not want to apply the insulin in the same place all the time because of the lipodystrophy and anaphasia.
Okay. How will you know the medication is effective?
If his glucose levels are stable.
Okay. So I don't have any questions. I'm ready.
You ready for
Yes.
it? Okay, we're going to administer and okay. Hi Ronald. Michelle will be our nurse today. How are you? Good.
I'm fine, thank you.
Okay. Have you been eating today?
Yes.
Okay. When was the last time you ate?
At lunchtime. And I had a snack in the afternoon.
Okay. And you're already planning to eat again?
Yeah, dinner's supposed to be here soon.
Okay. Okay, can you tell me your name and date of birth, please?
Ronald Jarvis. 4/21/1949.
Okay, and you have any allergies?
No allergies.
Okay, I'm checking that now. Is it okay? Okay, so we're gonna give you both insulin, the normal insulin and the Lantus. Is any question you have about it?
No, I don't think so.
Okay. You have taken this medicine before, correct?
Yes.
Okay. So I'm gonna check for clear, expiration date, make sure it's the right dose, right route, right patient. Everything looks good. And also check the other medicine, compare to the MR, right dose, right route, heart medication, now expiration date is good. Okay. So I'm gonna check just one more time. Can you tell me your name and date of birth, please?
Ronald Jarvis. 4/21/1949.
Okay. So I'm gonna scan. So how was your day today?
Oh, it's fine. Thank you.
We're doing you like to have the insulin?
My stomach, please.
Okay, we recap that. With 1 hand, we put in our sharps container. We verified that was the right amount, the right amount at the right time, and that you're willing to take it. And if you need to take it 30 minutes before a meal, your lunch will be coming. Okay, now we're gonna have another one. How are you feeling? You okay?
Yeah.
And you know the signs and symptoms for the hypoglycemia? Can you tell me what they are?
Like if I get a headache or maybe get feeling clammy all over.
Okay. And how are you feeling now?
Feel fine.
Good?
Ready
Are
for
you
dinner.
having any of these symptoms?
No.
Okay. I already confirmed and your meal is coming, so you are good to go. Is any other question that you have for me?
I don't think so. No.
Okay. I also provide the information about the diet that you asked for, the American Association diet.
Thank you.
If there's anything you need to ask, you just let me know, okay?
Okay. Thank you.
Thank you.
Okay, I have some additional questions. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, we check his glucose levels. We check if he eat. We check his allergies. So all this influence into the application.
Did this information affect your decision to administer the medication?
Yes, we want to make sure he has everything before we apply the medication, and he needed the medication, and he ate, and he has no allergy. So.
Okay. Did this information affect how you administered the medication?
Not really. The only thing it will affect it will be where he will like it, the injections. Okay. Is there any other question that you have?
No, thank you.
Okay, I'm gonna document all this, so you're more than welcome to observe.
Okay, thank you.
You're welcome.